Welcome to the Grief Relief Show with mother-daughter team doctors Gloria and Heidi Horsley, brought to you by the Open to Hope Foundation, helping people find hope after loss. Today we'll be talking about pregnancy loss and infertility. As soon as you see those two tiny pink lines on a home pregnancy test, your mind jumps into overdrive. You picture PTA meetings, father-daughter dances, baseball games, and tickle fights, and endless laughter. Your new reality is everything you wanted, until it isn't. A miscarriage rips out your heart in the most devastating way. It shatters your hopes, your dreams, and sometimes even your will to try again. And that struggle can weigh even heavier for the 1 out of every 4 couples who are trying to conceive but are diagnosed with infertility. As the realization that you may never have children of your own sinks in, your reality can become an unrecognizable battle with depression. And now, here's Dr. Gloria and Dr. Heidi.
Welcome to our show today. Wow, we've really got a pretty tough show today, don't we, Heidi, on infertility and pregnancy loss?
We do, and I'm so glad that we're doing this. This is so near and dear to my heart. As you know, I've had 2 miscarriages, and we will be talking a lot about it because it is such an unacknowledged loss.
It really is. It's one that people really don't want to talk about and deal with. And I know, after you've once said, well, I had a miscarriage or whatever, then it just kind of gets dropped, don't you think?
Absolutely. In fact, a lot of times people don't even know you've had one. So, you go around and you've had, and when you have a miscarriage, not only are you losing your pregnancy, but you're losing the future that you imagined and the future that you thought you were going to have.
And it's not just for the person who has the miscarriage either. Men are unacknowledged and relatives are unacknowledged. Parents are expecting to have that new baby when their loved one tells them that they're going to have a child or whatever, and then the miscarriage and the sadness around that.
Yeah, well, Mom, I've got to tell you, and I don't know if I've said this before, but when I had my first miscarriage, I sent you a fax. You were in London on a trip, and I sent you a fax, and you called me crying. And you said, Heidi, I'm so sad because I feel like I've lost the grandchild I thought I was going to have.
Wow, I even forgot about that, but it really touches my heart when you talk about it, and our kids are so important and grandkids to us. Well, we've got some wonderful guests today that are coming on to talk about pregnancy, loss, and infertility, and we're so grateful for them for coming in and sharing their stories and what they're doing. And then we'll have David Adamson on, who's a physician, and he's with the Northern California fertility doctors, and he'll be talking to us about in vitro. Let's take a look at the rollout for the fertility clinic.
Okay.
I'm a reproductive endocrinology and infertility specialist. I've been in practice with fertility physicians of Northern California for 17 and a half years. I do treatments for the broad spectrum of infertility-related treatments, such as Clomid, all the way up to in vitro fertilization and the most advanced technologies. In vitro fertilization entails a series of treatments where we try to stimulate the ovaries to produce many eggs so that we can collect those eggs, fertilize them in the laboratory, and then let the embryos grow before replacing them back into the uterine cavity. They either incubate the eggs and sperm together, or they'll do a procedure called ICSI, that stands for intracytoplasmic sperm injection, where they actually inject a single sperm into the egg to fertilize it. So once they do that, they place it in the incubator, and the next morning they'll check to see how many of the eggs fertilized. There's a table, special ICSI table, or a table that has the micromanipulation instruments there. So the specialized microscope and instruments that allow us to take a single sperm that we can use to inject it directly into the egg. After we fertilize the eggs, they're placed in the incubators, and they're not looked at until the day of the embryo transfer, because we want to minimize the amount of exposure to light and temperature fluctuations that can occur from opening and closing the incubator doors. So on the day of transfer, then the embryos are removed, and then we can identify which look good and which appear to be developing normally at that stage, and choose the best ones to replace back into the uterus. So after the embryo transfer, the patients will be continuing to take progesterone medication typically for the duration until the pregnancy test. We usually do a blood pregnancy test at that time, and we get the results back in a few hours, and then we let them know the results.
So Heidi, that's Dr. Kim. He was an amazing guy, and it was so much fun to go in there and talk to him and have him show us around the clinic.
Wow.
Really interesting.
It is. It's an incredible experience to realize that people are creating a child. It's
Right.
unbelievable.
Yep. And so now we've got Dr. David. Hi.
How you doing?
Thank
It's
you.
very nice to be here.
Thanks so much for
Hi,
coming on the
Dr.
show.
Adamson. How are you?
Fine,
It's nice
thank
to have
you.
you here. Thank
Thanks
you
very
so
much.
much for being here.
We
Thank
appreciate
you.
it.
It's a pleasure.
Well, it was great to go to your lab, and it's so interesting, the technology and kinds of things. But it must be something for you to have these couples come in and deal with them. It must, you have to be very sensitive, I'm sure, to be in this business.
Well, we really feel very fortunate because in vitro fertilization has really only been around a little over 30 years now since it very first started. There have been about 5 million babies born around the world, though, from IVF. And the wonderful thing about it is that it allows many people who could not have a baby 10, 20, 30 years ago now to have a child. And the technology has really progressed a lot in the last quarter century.
Yeah, I was going to say, it sounds like it's progressed a lot in the last 10 years. Because I did this 10 years ago, and I remember they wanted to fertilize 3 eggs, and they wouldn't do less than that. And that's changed a little bit, hasn't it?
Yes, it really has changed. The major advances, besides the fact that in vitro fertilization could in fact be done, which was in 1978, and the first baby in the U.S. was 1981, is that around 1991, a procedure called ICSI, or intracytoplasmic sperm injection, which allows the injection of a single sperm into a single egg and can be used to treat male factor, became much more used, and that helped about half the couples who have a male factor with infertility. And then really in the early 2000s, so just in the last 10 years, the technology in the labs improved a lot with the culture medium, and we really got to have much better survival of embryos. We also, just in the last 5 years or so, have been able to achieve much higher success rates with what's called vitrification, or freezing of embryos. And more recently, just in the last 2 or 3 years, freezing of eggs has become much, much more successful. And we're also really increasing our ability to recognize healthy embryos from other embryos that are not going to be able to make a baby. So you're absolutely right. The technology has improved a great deal in the past, and there are new and exciting developments on the future as well.
Yeah. Well, let me ask you this. It seems that there is a promise, though, to women out there, Heidi and I have talked about this, that they can wait later and later to have children. Is that a concern for you, that society is telling them to wait?
Well, in Hollywood also. I mean, you see these celebrities that are 46 years old, and it's like, so-and-so just had a baby at 46, and you're like, wow, okay. I guess this is something that can happen for anybody.
Well, you're right, and it is a very, very big issue. And of course, as a reproductive endocrinologist, I'm really supportive of women's rights and supportive of better education and the economic development we've seen in the last 4 or 5 decades. It's very important and very critical. But I think what's really essential is for men and women both, when they find their partner that they want, to talk about planning a family, not just contraception. And at some point in time, it's important to move having a family towards the top of the priority list. And if couples do that, they'll have their children without necessarily having to go to the technology. The technology can be very helpful, but you're completely right. It does not solve all problems. And once there aren't very many eggs, a woman gets into her 40s, the chances go down dramatically. And so it's important to try earlier. And you're also correct about the media. In some ways, you see the Hollywood stories, but almost all of those women have used donor eggs from very, very young women. And it's very unusual for a woman who's 45 or older to have a baby. And really, certainly by the age of 40, it's getting a lot more difficult than it was at even 35 or 30.
Wow, I think that's such good information, don't you, Heidi? Because
do.
I think that also helps women who are not successful at it not feel so like, wow, why couldn't I do it? You know, when all those people are, when they have to realize that their odds, if you want to look at it as odds, you know, do decrease.
And
so,
why is my body letting me down?
Yeah, exactly. Why is my body letting me down?
I did hear a really exciting story just in the last week where people had frozen 7 eggs or something, and then they had their couple kids, and so that they donated the other eggs, and then someone had children and they actually know these children now. I mean, it was this great story about how you can do that. So.
Yes, well, embryo donation, which has been more commonly done in the past, can be very successful. And certainly there are a lot of frozen embryos from couples who've had babies and they have their family and they have extra embryos. And we think it's a wonderful thing when they donate those embryos.
Right.
And so that is definitely a new technology that's helping people.
Well, we want to have Beth Jaeger-Skigen come in right now because come on in, Beth, and join us.
Hi, Beth.
Hi. We're happy to have you on the show today. Hey, Beth.
Hi, how are
Welcome.
you? Thank you.
I'm going to have a seat on the chair by Dr. Adamson.
Sure.
And we were excited about getting Beth on the show. And the reason we were is because Beth has been through the in vitro process 3 times unsuccessfully, right? I don't know if you call it unsuccessfully, and then later was successful. So
And had twins.
Yeah, and had twins. So we felt like that she had a good story for people out there who are having problems. And talk a little bit about your experience with it, Beth.
Well, I'm a therapist who specializes in all aspects of infertility. And when I was going through infertility, I was a therapist 10 years ago, and I decided when I got to the other side of it that I was going to specialize in it because I felt so alone in the process. I felt like it was a really silent grief that was out there, and I really find that I run a lot of support groups and I do individual therapy and couples therapy, and I find that people feel so isolated with this invisible loss that goes on. Yeah.
And how about the experience of in vitro? I mean, really taking it out of your body and putting it in a lab and putting it back in? And,
Yeah,
I mean,
it's a really good question. And while it's super exciting that we've had all these advances, people's first choice is not to go to a clinic to procreate. They envision being able to procreate naturally. And it's painful to have to let go of that dream. And usually by the time people get to in vitro, they've had months after months, maybe years of trying. And if you look at that, that's the hope of getting pregnant every month and the loss of not getting pregnant. And those losses compound over time. So by the time they get to in vitro, it's they're kind of oftentimes coming in crawling, really feeling desperate and scared that it might not happen for them.
wow. I know that your clinic has yoga and all sorts of things going on for them, right? They have a
wonderful.
whole program.
Formal mind-body program.
Yeah, a
That's
mind-body
great.
program, which
I love it.
yeah, which is important. Now, you had some ideas, Beth, for people who are going through it. Some of the things that they can do for themselves.
Right. Well, for one thing, I want to say if you're going through infertility, you are grieving. So acknowledge that there is grief going on and don't try to fight it because it's going to be there. I think sometimes for people seeking support systems through Resolve, which is the National Infertility Organization, getting professional help, possibly with a therapist that specializes in infertility. But sometimes people like to journal about their experience. I've had a lot of people plant a memorial garden for pregnancies that they hoped would happen but didn't. I think joining support groups is oftentimes useful.
I like that. I want to say something about the support groups because one thing about having miscarriages is there's a lot of people that will say things like, well, at least you could get pregnant. At least you have another child. At least you're still young. At least, et cetera, et cetera, et cetera. They minimize what's going on. So I love the idea of getting together with other people.
And you bring up such a good point where people want to like put a Band-Aid on it and it's going to work out. And I believe that if someone wants to have a child, they will. But it doesn't take away from the pain of right now, of the losses of right now. So yes, at least you can get pregnant, but you're grieving the loss of this pregnancy, of this baby you wanted to have.
Yep.
And that's really important. And I think it's I've had people walk into my groups and say, oh my God, I'm not crazy. And people feel like they're living this dual life. They're going to work, they're on the subway, they're on the BART, and they're torn up inside, and it's such a safe place to go and feel like, oh, I'm not alone.
Yeah, I love that.
And I wanted to ask Dr. Adamson, how about the men? You know, we're hearing about the women. What do you find with the men?
Well, I think the men really do suffer, and I think certainly women, just biologically, it's usually more because they've had the physical loss as well. But what I hear from the men is that they are really suffering not only for themselves but for their wives, because they know it's hurting their wives so much, and they try to be helpful, but the reality of it is whatever they try, it's not enough, because there isn't anything that's enough. So they feel very frustrated and inadequate that they can't help the person they love so much to get over this. So that begins to play on them as well, that they feel that they're a failure, that they can't be more help. So it's very frustrating in different ways, I think, for the woman and the man when they go through this. But they do go through it together.
Right. And if you think it's isolating for women, for men, that it's never talked about. It's really not
Good
talked
point.
about.
Yeah. Well, let's take some questions from our studio audience here. We've got a great studio audience. Heidi, you want to go out and
Sure.
see if we have some questions? Okay. You want to stand up? Sure.
Yes, and can we get your name?
Sure. My name's Locke Anderson. Dr. Adamson, how do you handle a situation where the couple doesn't necessarily agree on keeping on trying, or how long to keep on trying?
I think that's a really good question, and it's a very common problem, actually. And I think the first thing, actually, maybe is to have a bit of a mediator in terms of the physician and a counselor. And certainly, if there's any significant difference, immediately I recommend that both the man and the woman, either individually and or together, see a counselor who can talk with them. And the first thing I try to do is outline realistically what their chances are, you know, with the different choices that they have. So what are the realistic, real probabilities or chances of pregnancy, and what are their options, such as adoption or use of an egg donor if that works. And then once they have the facts, to ask them to think about that, and then to go into their feelings about what they really want, and then to communicate with each other so that they can come to a resolution together. But I think it's a process. It can take some time, but it's absolutely critical that they work through this together. And I think usually with some kind of professional assistance, someone who can be objective and see all the different viewpoints. And it's very important to do it, though, because it can destroy relationships if it's not done properly, not dealt with properly. Thank you.
Okay, anybody else?
Yes.
Hi, my name is Rebecca Vera. My question is, how do you approach talking to people who've had miscarriages about their miscarriages? Is it appropriate to ask them about it and acknowledge it? And as someone who's never had a miscarriage, I would be uncomfortable to talk to people about it. Is it appropriate?
I'm a believer in always asking how people are doing, and not sweeping things under the carpet, because if I think the common misconception is I don't want to upset them. Believe me, if they've just gone through a miscarriage, they're thinking about it all the time. And I care is really important. And you can also say, is it okay that I asked? Is it okay if I ask again? You know, is that helpful? And let the person who is going through the loss pave the way, but ask them how to pave that path.
Yeah, I like that. And it was interesting because when I had my miscarriages, I didn't realize how many women that I knew that had had miscarriages because they'd never told me. And when I had mine, they told me, and I went, wow, I'm not alone. This happens a lot more than I thought it did.
You know, and I'm thinking, what about the guys? I mean, nobody says, well, I just heard your wife had a miscarriage, and I'm really, really sorry about that, that you've had a miscarriage. I've been so fascinated nowadays with the fact that it's our pregnancy.
Yes.
In my day and age, it was your pregnancy.
I think that's
so,
true.
that's changed. So I guess one thing I'd like to think about from this whole thing is not only acknowledge the women, but the men too. And thank you too so much for being on the show today.
Thank you.
It's been really great.
It's really
Thank
been a
you
pleasure.
so much
Thank
for the
you.
important work you're doing.
Thank you so much.
Both of you. It's great. And we wanted to have our special
This has been the Grief Relief Show, hosted by mother-daughter team Drs. Gloria and Heidi Horsley. This show has been brought to you by the Open to Hope Foundation, helping people find hope after loss. Be sure to visit opentohope.com, where you can listen to radio programs, watch Open to Hope TV, read articles, and view books. You can also join Dr. Gloria and Dr. Heidi on Twitter and Facebook and put your events on their international calendar. Thanks for watching, and remember, others have been there and made it, and you can too.